the National Museum of Civil War Medicine, in conjunction with the Conococheague Institute, presents Side-by-Side Surgery, Amputation Through the Ages.
Hello there, I'm Kyle Dalton with the National Museum of Civil War Medicine. Happy to be here at Conococheague Institute. Thanks for having us.
The Conococheague Institute, thank you, Kyle. I'm Matthew Wedd, new operations manager here, and the Conococheague Institute is situated in Franklin County, Pennsylvania, near Mercersburg.
And Civil War Medicine, the National Museum of Civil War Medicine, has 3 locations in Washington, D.C. That's the Clara Barton Missing Soldiers Office, our main building in Frederick, Maryland at 48 Patrick Street, and the Pry Field Hospital Museum on Antietam National Battlefield. We're glad to bring you this great program today, comparing amputations of the 18th and 19th centuries, a major and important surgery. If you like programs like this, consider supporting our organizations. The National Museum of Civil War Medicine can always use new members like you that make these programs possible.
And we are a 501c3 non-profit too, and so we have membership, and of course donations are appreciated to keep us sustained. Now of course, Kyle, with your museum, medicine is in the title, hence medicine. The Conococheague Institute has various roles, from teaching about colonial America, the natural resources that surround us, but we do have a focus on medicine because one of our donors donated a very comprehensive original 18th century surgical kit, and so we have that resource, and so it's one of our primary school programs and one of our primary draws for our collection.
Excellent. Well, we're glad to work together with you. As I said, today we're talking about amputations. For my period, of course, it's very big. It's hugely important. How common was amputation in the 18th century, or can we really say?
Sure. Well, if you ask anyone, name a fact about colonial medicine or surgery, they'll usually talk about amputations or leeches. And amputations are absolutely a big thing, whether it's for a blood poison or for a gunshot wound, hit a bone or a compound fracture, they are happening. But the big thing is they're not happening without reason. Like any medicine today, this is not a barbaric time of randomly cutting. These are scientists, it's an age of enlightenment. And so when they're amputating be it a finger, an arm, or a leg, they're doing it with the right scientific reasons in mind.
And it's much the same for our period too. We're trying to get away from the myth of the sawbones, these unfeeling doctors that enjoy cutting people's limbs off. Sure, they existed, but in such minuscule numbers, it's really not fair to paint a brush for the entire profession off of just those few.
You say that, but there are some 18th century surgeons who are pretty badly maligned. And of course, when your fabled anesthetic is invented, some surgeons do complain the anesthetic makes the patient very obviously unconscious. You really can't get a good feel for how the surgery's going unless you can feel them squirming and screaming under your knife. So,
and that is probably the biggest difference in this operation, in this surgical operation between your period and mine, the 1860s, is that anesthetics are widely accepted by the time of the Civil War. Nearly all major surgeries are done under some form of anesthesia, like chloroform or ether. And in your period, there's none of that.
Yes, so when was ether introduced?
It was introduced in October of 1847. There were some experiments a few years before that, but it really exploded onto the scene in October of 1847 when a dentist by the name of William T.G. Morton demonstrated the use of diethyl ether at the Massachusetts General Hospital, I think, or Massachusetts General Hospital, MGH. And there it really just blew up. Everyone started using it across the globe. At a demonstration in England, one English doctor said, "This is no Yankee humbug." Almost immediately it saw military application. There's a photograph, the first known photograph of a amputation under anesthesia from the Mexican War, just a few months later. There are Mexican and American surgeons working on a Mexican sergeant amputating his leg while he's under the influence of ether. So by this period it is hugely widely accepted. What did you do for pain in the 18th century?
So one of the best skills of an 18th century surgeon or physician when using some sort of cutting implement is speed. Because a patient's going to feel the pain, you want to operate quickly. So an amputation of a capital limb, say a leg or an arm, will be done in about 3 minutes, which is actually quicker than I can describe it. There are pain-reducing drugs. The Verbaic tincture, or the alcoholic tincture of laudanum, is of course an opium base. Opium relieves pain. A lot of people have this misconception that the best medicine is a big old shot of rum. But surgeons in the 18th century preferred their patients to be sober because alcohol, of course, inhibits healing. It's not a good thing for the humours. And so surgeons would prefer patients to be completely sober or to have the medical grade alcohol, the Fabaic tincture.
Yeah, they're using a lot of brandy and whiskey in the Civil War, but not for pain relief. It's used as a stimulant oftentimes. If your patient is going into shock, you use that to kind of prevent the shock, for example. But they're not using it as pain management in any way. Pain management in the Civil War is mostly opium, laudanum, as you mentioned, being one of those, in such gigantic quantities that there's an epidemic that follows the war that doesn't really end until the 19-teens. So yeah, pain management seems to be fairly similar between the two, giving a lot of opioids.
A lot of opioids and good peace of mind. A surgical manual that we have for the mid-18th century does say, when doing any operation, make sure the patient knows what's happening and be confident.
That makes a lot of sense. Doctors in the 1860s, I think, are a little bit more withdrawn. You do see exceptions to that, especially the big names. Lister, for example. Mutter, Dr. Mutter, whose Mutter Museum is not too far from here. They are known for being kind to their patients, but the fact that that has to be pointed out, I think, says something about the period. The first set of medical ethics out of the American Medical Association, AMA, actually has a set of rules for the patients of how the patients are supposed to treat their doctors. So there is this sort of paternalist, overarching, kind of a distant and authoritarian view that doctors have in the 19th century.
One of the things that, again, people have a bad idea of surgery is that you talk about accidents happening, cuts being made badly, people dying from maltreatment. When you just read a book, it is very hard to get a practical knowledge. And so to be a physician and a surgeon, you should have about 8 years of apprenticeship or 8 years of university training for the 18th century. And that usually involves lots of lectures, dissections, which is great. But if you're a country doctor and you specialize in kind of simple things, little fractures, herbal remedies, the first time that you have to do an amputation of a leg might be the first time you've ever cut in someone's body. And that's when those accidents happen. And it's the same during every major war, the Revolutionary War, the Civil War. You hear bad stories because that mass recruitment for surgeons might not be the highest class of physicians from Massachusetts or from London. It might be an officer who has said, well, I've read some books.
And you do see that in the Civil War too. Before the Civil War, 9 out of every 10 Army doctors had never treated a gunshot wound. This was a country that was not prepared for what was coming. And that includes the medical professionals. As you said, a lot of them had never performed amputations before. And by the end of the Civil War, it is the most common surgical procedure. Over 60,000 amputations, capital amputations, by the end of the war.
So there's a lot of similarities and differences, and I'm sure if we change hats and outfits, we could probably do the operation in both. But how about we look a bit more at the kind of steps of the operation itself?
Absolutely, that makes sense to me.
So a hypothetical then injury we both need to treat. Let's say the musket ball or the manable to the kneecap. So we're going to want to amputate above the joint, of course. Because as surgeons in my time period say, you can spit in a lung, you can vomit in a stomach, but if you so much as breathe on a joint, you're in trouble. So when amputations are happening, they're usually done either below or above a joint, but very rarely on it. So a musket ball, a navel, has hit the kneecap, shattering the bone, completely pulverized it of the knee. So of course it can't be fixed. What's going to happen to that area?
It's got to come off. There's no treatment even in many cases in modern medicine today where you'd be able to save that limb.
You can't put it back together. Of course, if you leave it, you're going to get a gangrene, you get blood poison, which everyone knows that word, gangrene. And so that's the main reason for removing that limb, is to save the rest of the body by removing the wounded, the damaged, or the poisoned part.
And gangrene is a major issue for both of our periods because germ theory doesn't really start to come into its own until 1869, after the Civil War.
Yes, so you often read about surgeons cleaning their implements for sharpness sake, but never for cleanness sake. So right now, yours are very clean.
Yeah.
Mine are a little
rusty. It's a new
rusty.
set. This is
but yes, I might just sharpen them, and then throughout a battle or throughout a long week at hospital, it's being used on several patients without being disinfected as we know it. The same my muscle retractors with its blood stains on. And even of course the hands, the clothes are not being sanitized, so lots of germs, of course post-op infections.
Yeah, in the antebellum period, you see doctors bragging about how stiff their clothes are from the blood that's soaked in. And during the war itself, there's one surgeon who talks about his hands being pruned like a washerwoman's from all the blood that he's been working in.
Right now I am dressed more for conversation. How you are with your sleeves rolled up, that's fairly common of 18th century surgeons too. Often wearing an apron on front,
yes,
tying up the sleeves, because you do need to get in there. But
yeah, and you see a lot of photos of doctors without hats when they're working on patients, doing amputations in the 1860s. But otherwise, yeah, this is largely how they would have looked when coming to the table.
Okay. So, I guess then we'll go step by step. So, we want to remove that leg. What is the first instrument from both our time periods? I hope.
Yeah. Yeah, the Petit tourniquet.
So named for a Frenchman, I call it the screw tourniquet, and there are other variants as well. But much like modern surgery or any first aid, you want to place it above the wound and then screw, tighten it up. I have an advantage here with my clothing, my breeches. I can actually demonstrate most of this on myself.
I'm glad you're willing to do that. Yeah, there's a buckle on ours that drives through and holds it in place. Looks like you've got a similar mechanism to yours.
Yeah, so I'm gonna get that buckle on, and then slowly apply pressure, and it adds an even pressure. Now you can use anything as a tourniquet, but this is one of the best. It's one of the big innovations.
And you do have a couple of other forms of tourniquet in the 1860s as well. Some is just the strap. There's also talk about using broad sticks. Soldiers should carry sticks in their pockets so they can make their own.
Much like modern first aid today.
Yeah, or drumsticks by musicians. Might do the same thing in my period. But yeah, this is the first step. You apply the tourniquet right away. It falls out of favor in the late 19th century because it's overused and a lot of people lose limbs when they really shouldn't have. But it's still an important tool today. In a recent paper in, I think by the National Institute of Health, they found that modern traumatic amputations have a 15% mortality rate unless a tourniquet is applied properly and early, and then it's only 10%. So that's a pretty huge difference in survivability over the use of tourniquets to this day.
That's why I always wear a belt when I'm hiking.
Yeah.
Okay, so from there, of course, you have your warm water heater, you have your linens and your bandages and your stumps. You want that post-operative care ready before you start the operation, otherwise you're going to be in trouble scrambling. Do you have your bandages?
I don't have my bandages with me.
He's going to be scrambling.
But while applying the tourniquet, again, this being a big difference, then they would start applying the chloroform or ether in the 1860s. And it takes a few minutes for them to take effect. For chloroform, the average length is, I think, 9 minutes, 6 to 9 minutes, somewhere in there. And it takes only about a shot glass, about 2 ounces, to put someone under. It's inhaled. You put it in a paper or cloth cone, and you pour it onto a sponge in the top, and then they breathe it in through their mouth and nose. So while you're busy with your tourniquet, and while we're busy with our tourniquet, in the 1860s, they're also applying the chloroform at about that time.
Yeah, I'm just asking my assistants, my nurses to make the patient comfortable, a few blankets under the shoulders. It's best to do this in a horizontal position, but with the head slightly elevated.
Yeah, you see the same thing in this period too, and they're really worried about breathing in this period. They're getting really scared about overdosing with chloroform or ether, so they're actually giving a little bit less than modern doctors would for the size of the patient, but that's a generalization. There's a lot of movement in there. It hasn't become a science yet, anesthesia.
I should add that when amputating anything, something the surgeons have to try and do is not avoid redoing it again. So cut way above the poison tissue, for example.
Yes.
Cut into healthy tissue, because otherwise you may save a few inches of the person's leg, but have to do a resection, another amputation a month later if you miss some of that gangrenous tissue. Alright, so for me then, the next step is a Catlin knife.
For me, it's a scalpel.
A scalpel, that's nice too, we could use those. And the aim here is to cut through the main skin layer for me, the adipose tissue. So a circular incision all the way around, so you can peel back the skin off the muscle.
Yeah, you see the same thing for the 1860s. Obviously the knife is a little bit smaller, little scalpel, but it's done also in a circular method. Sometimes you'll see curved blades, not unlike this scalpel here, and the surgeon might even get underneath the leg and position their arm as such to make it a little easier to get that full circle. And they make a lot of effort to get the cuts to line up. I say kind of like an avocado, when you're cutting an avocado and you want the lines to line up. If you get a gash in there, that wound is going to take a little bit longer to heal if you haven't cut it quite properly.
There's another method apart from peeling the skin back, is to, if you're cutting here, to cut some of the skin from the back of the leg here in kind of a pouch, and you want to save that skin for later. But right now I'll just peel back my skin, my breeches.
Yeah, in the Civil War you have a couple of different methods for cutting flesh, but they're all intended to flap. They're all intended to close over the stump so that you have full skin coverage, which is, again, not unusual. It's just maybe different ways of cutting.
The body heals best with its own material, so skin helps. All right, next up, because again, speed is my essence. I've got 3 minutes to do this operation. Speed for me is a very large, heavy, sharp amputation knife.
Now it actually depends for my period.
I like that.
This is also a Catlin knife, not unlike what you used for cutting flesh. This was used for cutting muscle. You scoop the muscle up and away. You cut into it and lift it up, sort of layer by layer, to slowly expose the bone. So I get a lot more luxury of time in my period to actually work through the bone and make sure you're getting it all quite correct.
Yeah, for me this is a 2-cut job. 1 cut on the inside, all the way to the bone, 1 cut on the outside, all the way to the bone. So we're just really pushing for all that flesh or muscle, because again, speed. Your Catlin is going to be used, like you said though, once all that main flesh, you're going to have ligatures, you're going to have little bits of muscle that have not cut with the tension of the knife. So then you go through the bone and just slip those. Sometimes have your nurses kind of pull them taut so you can whip them out even easier.
If we're drawing veins out, we use Tenaculum to sort of pull them one by one and tie them off. This can be done before or after the main cut, depending on how tight the tourniquet is and where exactly you're cutting. But generally it's going to be before you start getting to the bone for a surgery like this, for example. There's just too much blood flowing through there. You can't risk slicing through those and letting your patient exsanguinate or bleed out.
Sure. So for myself, of course, we are going to get to the bone saws, which is a major facet of this operation, but a surgeon wants visibility for his sawing. And so most 18th century paintings and sketches of this operation either has several nurses or surgeons tugging on the limb to basically pull the flesh off the bone, exposing it. Or you can use this. This is a muscle retractor. You slide this around with a cut spin, and of course it will be on the bone, and then your surgeons and your nurses can tug that to pull the muscle and meat off very easily.
Yeah, we don't really have it. I don't know of anything like that in my period.
Just tug.
Yeah, I think it's just you're scooping away with the Catlin knife and moving them bit by bit and taking your time. But as you said, speed is of the essence. The longer you're spending on the surgery itself, the less likely it is your patient's going to survive.
I have had the pleasure of speaking to a modern Canadian surgeon about this operation in a program, and he described to me the sound it makes. It's kind of noise. So, as you might expect, pulling meat off the bone.
That sounds about right. So the bone's exposed now.
Bone's exposed. We're sawing through the bone. Exactly the same thing here.
Pretty much, yeah.
An even saw, if anyone's ever sawed at home for carpentry, you'll often notice you're sawing through wood. Near the end, you're very likely to splinter.
Yes.
And that's something you want to avoid in an amputation, because a jagged bone is going to be a sharp edge. And so when the wound's healing, it might poke through and redo. And so surgeons often kept files with amputation kits that you could literally, if you've got a jagged...
Yeah, I've got a bone file right here for that. We also have the ronger, which is a clip it clips the bits that hang off. If you got a little splinter hanging out there, you just slice it and then use your bone file to really finish it off. Again, I've got a little more time to work with mine.
Shaping it, edging it around, making it artistic. Okay, so the leg is now gone. The leg is now gone. In this case, my leg is now gone. And so if you, of course, undo the tourniquet, you bleed out again, you exsanguinate.
Yes.
So when you talk about tenaculum, that is our main goal now, is to use the tenaculum to expose the veins and arteries so we can tie them up. Now, a lot of people think about, again, these operations, and think about cauterization, basically burning vessels to stop them from bleeding. And in modern science, they have very high-powered lasers. There's not a huge amount of high-powered lasers in the 18th century. What about 19th century?
Yeah, we haven't really gotten to the laser stage by the 1860s.
Okay. So up until the 1500s, cauterization of veins and arteries is still used, but a physician, Ambrose Pair, really starts to put that on the back burner in favor of ligature, tying something off. So in this case, we are literally going to expose the arteries, those blood vessels, and as a English surgeon of the mid-18th century, to tie them off, I'm going to use a curved needle and thread, largely just tailor's thread, so waxed linen.
In our period, again, using the same kind of needle, surgeons still use curved needles today. It's a very easy and practical way of using ligatures, but we're relying on silk in the 1860s, by and large.
And the French in the 18th century did use silk as well. So the problem with ligatures, of course, is your body does not like foreign stuff in it.
Yes.
So whether it's waxed linen or silk, if it's left inside the body's going to reject it. You get infections, and of course that can lead to post-operative complications. An American physician, Philip Singh Physic, is noted, he's actually the turn of our centuries, 18th to 19th century, he kind of brings catgut into American surgery, and catgut, being an animal product, breaks down a little bit better, and so it does help reduce infection.
In the Civil War, they do sometimes use catgut. It's pretty rare. They are mostly relying on silk. In the Confederate forces, they start using horsehair in some cases. Silk is harder to get because of the blockade. It's much more expensive. Horsehair, though, is not very pliable. It's not easy to use as a ligature. You have to boil it to make it pliable. And that boiling unintentionally disinfects it. And so people with horsehair ligatures are less likely to get infections than those with silk ligatures.
For our manuals, it talks about when applying the ligatures to the veins and arteries, don't go through too much of the artery. You don't want to cause extra damage. And then if possible, leave some of the thread out of the wound, because eventually you're going to want to remove that, and as the artery closes itself, you can pull the thread out and thus letting the body heal with its own matter. Famous example of that not happening is Admiral Nelson of the British Navy. He's actually 19th century when he dies, but he's an 18th century hero. His arm is amputated, and his arm is extremely infected. And the reason was it's actually a French silk was inside his arm, and it was all inside, and so it kept getting infected. It would pus up, it would swell, it would pus up, it would swell, but they didn't want to re-cut into him in case of course endangering his life. So eventually the entire thing just bursts, the threads come out, his arm heals perfectly. Well, his stump did. So yeah.
Postoperative care is something that they do start to really focus on in the 1860s. There's a dramatic increase in permanent hospitals, what they call general hospitals. Some of them are purpose-built, others are buildings that are seized or rented by the federal government or by the Confederacy. There is a big emphasis on getting these guys well enough to go back home. They know at that point, if you have an amputation, you're not going back to the front line. It's time to go home. And they do make an effort to really increase that level of care. So the survivability of amputations goes up a lot during the Civil War. Before the war, about 50% of people in civilian life died from traumatic amputations. During the war, that number fluctuates from like 25 to as low as perhaps 9%, which is even lower than today. And it's unclear exactly why that happens. It'd be great if we did know. But you do see dramatic reductions in the mortality of the amputation mortality through the course of the war.
And of course, we look at mortality figures. They may seem scary, but this is the case of, okay, 50% of civilians. However, without the amputation, it'd be 100% of the civilians.
Yeah. Amputation is used almost exclusively when it is absolutely necessary in these periods. These doctors, by and large, aren't idiots. They know what they're doing.
So actually, we kind of skipped a step. So close off the veins and arteries.
Oh, yes.
Your skin flap, however you've cut it, you can wrap it round, bandage it with tow, some linen fibers, some roll bandages, and then just put a stump sock over the entire thing. And then make sure your patient has lots of sleep. Sleep is one of the best ways your body can repair itself. And surgeons recommended a soporific medicine to help the patient fall asleep and just heal.
Yeah, they did apply a lot of painkillers, those opioids we mentioned in the Civil War. And there was also a big emphasis on prostheses. There's a major revolution in the improvement of prosthetics during the Civil War. One of the first amputations of the war, perhaps the very first, was Private George Hanger. He was a Confederate private. His leg gets taken off by a cannonball, and he has to have the rest of it amputated, getting again above the wounded tissue into the healthy tissue. And he's so unhappy with his peg leg that he starts making his own improvements. And the Hanger Clinic still exists today. It's still a major provider of prostheses for people with missing limbs.
And again, it varies on who you are. It depends on your class and what country you're in. So a simple fake leg like this, the peg leg that we associate, would work quite fine. This one's cushioned, so it doesn't put too much pressure on your stump, especially with that jagged piece of bone. But right back to the Italian Renaissance, there are mechanical prostheses, literally arms that are fitted over arms, that if you kind of pull a latch, you can make the hand move. So again, it's not too dissimilar today. The other stereotype, of course, is the old hook hand. And with all prostheses, it's about making the patient comfortable as they can be. There's a wonderful 18th century image of the veterans of the British military and the veterans of the British Navy playing a lovely game of cricket together. And they are all peg-legged, peg-armed, but they're still having fun playing cricket.
Well, I think that about wraps up from the very beginning to post-operative care.
Yeah, so it is a fascinating subject. Of course, it combines history and science with some grossness and entertainment as well. It is very stereotypical amputations. There are hundreds of operations that we could talk about.
Oh yes, yeah, and maybe we will in the future if you enjoy this video. But thanks so much for hosting me here at the Institute.
Thank you.
Again, I'm with the National Museum of Civil War Medicine. We were happy to partner with you today. And if you want to support us, consider visiting our sites or becoming a member.
Yes. Visit sites, become a member, and just keep sharing these stories. The history, the medicine, share them, learn more. And I do encourage self-study for this. It's a fascinating subject.
Yeah, there's lots of easy to find resources out there, and both of our websites will have resources that you could use.
Well, Kyle, from the Conococheague Institute then, I wish you a good day.
And thank you very much for hosting me.
Cheers.